Come on in.
Morning.
Good morning. I'm Renee Jones.
Good morning, Val.
I'm Morgan. Go ahead and have a seat for me. Well, definitely, we are excited here at Virginia Industrial Medicine to have you interview today for your externship. Tell me a little bit about yourself.
Well, energetic. I'm very outgoing. When I do something and I set my mind to it, I get it done.
Okay, very good. Well, tell me a little bit about your background.
I'm an MA. I'm graduating from ECPI, and crap.
It's okay, that's why we're practicing.
um,
Tell me a little bit about the skills that you've earned at ECPI University.
well, currently we learn blood pressures, injections, phlebotomy, and learn how to do vitals. And also I learned billing and coding, some of the EHR, and CPR.
Okay, very good, very good. What would you say are your greatest strengths heading into this externship opportunity?
I would say my greatest strength would be my skills. I'm very confident in them.
Okay, very good, very good. Well, here at Virginia Industrial Medicine, we work with employees that have been injured on the job. They may need physicals, they may also need drug screenings for a new position, or it may be that their number was drawn at random and they have to be randomly screened to keep their position. We'll be doing CDL physicals, CDL drug screenings. So we are, we also see family practice patients as well. We have 2 nurse practitioners and 2 physicians that are our primary providers, but we're a very busy practice, and you never know from day to day what you're going to see walking through the door. If somebody gets injured on the job, they might immediately come to our facility, whereas some patients would be scheduled for a routine physical or a drug screening or something like that. So can you give me an example of a scenario where you've worked in a very fast-paced environment and were able to multitask?
Well, before I went to school at ECPI, I was a lead management at Dollar General. There I would do stocking, help up front at the register. Sometimes customers come to me asking me where some product was, I have to go find it. So that made me learn how to manage my time better.
Okay, very good, very good. And what about on campus? Are there some skills or scenarios that you utilized on campus that would help you in a very busy healthcare setting like I just described?
Yes. Kerry Bernard, he would have us do, I would say, trial runs where we'd be timed and we had to meet that requirements.
Okay, good, good. Yeah, it's very important that we keep the providers on pace throughout the course of our day, because we can get quite busy and we have to be able to see all of the patients that we have scheduled, and of course walk-ins as well. So we need to have somebody who is very flexible and can manage their time well. Can you give me an example of maybe a time when you worked at Dollar General where you had a difficult customer with a problem, and how you resolved that issue?
Yes. We had a section where we would put items that were discontinued, and during that time, some of the items didn't have a price on them. A customer came to me and she actually told me that since one of the items was $1.25, that she wanted that price for the item that she wanted. During that, I would have to call my boss and get her help with this situation. But during that time, I had to calm the customer down because she was interrupting other customers shopping.
Okay, very good, very good. We may have scenarios where somebody is getting a physical for their CDL, and maybe their blood pressure is too high for them to be able to earn their CDL. Nobody would obviously want somebody driving a big rig that has high blood pressure, could potentially have a problem behind the wheel. So there may be some times where a patient gets pretty upset about a result that they get because it could affect their ability to make a living. Can you tell me how you might handle a scenario where a patient who was trying to get their CDL physical had a high blood pressure, and because the pressure was so high, they weren't going to be able to get their CDL? What do you think you would do in that scenario?
Well, in that scenario, I would talk in a calm voice. I wouldn't raise my voice at all, and I would try to explain to him or her about why they couldn't get that physical done or why they couldn't get that CDL.
Okay, okay, very good, very good. Well, do you have any questions for me as the practice manager?
Yes. What are your patient interval times?
Well, typically our scheduled patients, we schedule patients every 15 minutes. Now, we also try to have some time set aside each hour for walk-ins because we will get a lot of walk-in patients. So sometimes it might be at the first 15-minute interval of a brand new hour, or it might be the last 15 minutes of a brand new hour. Because if we have two of them back to back, that gives us 30 minutes to see walk-ins. We do see a lot of walk-ins. Obviously, because we are an industrial medicine practice, there are a lot of facilities in the area that do utilize us for their employee wellness and for any kind of issues that occur on the job. So on a day-to-day basis, we get several handfuls of people injured on the job that need to see us. Some of the most common things that we see, things that get in people's eyes. It either gets around their eyewear, their protective eyewear, or maybe they didn't have their protective eyewear. We see lots of cuts that sometimes need stitches. We'll also see, unfortunately, a lot of back injuries. People that use improper lifting technique and they pick up something that should have been a team lift, or they use poor biomechanics, and that leads to some sort of back injury. And we would ultimately, do what we would need to do to work that patient up. We might even refer them for physical therapy as well.
Okay.
Did you have any other questions?
No.
Okay. Well, we will definitely be in touch. Thank you so much for your time, and we look forward to an opportunity for you to come here as an externship student. Thank you so much. Okay.